Back in Dr. Crapo's office, talking about cosmetics, cosmetic teeth, I assume.
Yeah, cosmetic dentistry, which ranges from white fillings that people are having done to replace silver fillings, to whitening of teeth, to porcelain veneers, to whiten and strengthen teeth.
How much of this do you do? Is it a big part of your practice?
Well, nowadays people don't accept silver fillings anymore. So in terms of fillings, most of them are white fillings. Whitening of teeth, a significant part, yeah. People ask about it. Sometimes they want to try the pharmacy brand, and those work too. We do a lot of reconstructing of bites, and so, yeah, cosmetics are part of the whole process.
Does whitening of teeth really work? I'm a skeptic, you know.
Yeah.
I mean, is it a noticeable difference after you've had it done?
Absolutely, absolutely. If people arrive at, say, our age and they haven't had much
speak
done,
for yourself. Okay, no, carry on.
Yeah, maybe you're much older than I am. What can we say?
Who knows,
yeah.
Right. But it actually works. That's the
It
thing.
actually works, and the people who like it the most are people our age, because the range of change is so dramatic. Yeah, it's amazing.
Now, caps versus veneers. Veneers always seemed like a strange idea to me because they sound like they'd be like a fingernail or something.
Well, historically, they were like a fingernail, and the way they were done lent itself to a lot of stress and breakage and fracturing of them. And so every bite, every bit of the function that a person goes through must be analyzed carefully before we decide, are veneers appropriate for you? And where they were the rage and everybody was just getting them put on, there was some problems with that, and people would be unhappy if after a few months or years things started to break or crack. And not all veneers do that, but that was a problem with them, and so we have to analyze the bite before we even think about veneers.
So caps or crowns, which is there a difference between the two?
Well, caps are sort of the nomenclature that are used by the public. Crowns are the scientific or clinical name for replacing teeth.
Well, Nancy, well, smile, Nancy. There we go. You have a great smile, but now we have a before picture of you, and things were a little irregular then. How did you feel about that? Did it make you crazy or what?
I didn't like it, but I really didn't realize how bad it looked until after it got fixed.
Okay, and Dr. Crapo,
Dr.
look at this,
Crapo.
an endorsement right here. In the
Dr. Crapo fixed it, and he made everything look much more even and natural, and now I'm not near as upset to smile.
No, well, that's
All
good.
my early pictures, I didn't smile in at all.
Well, everybody should be smiling all the time. And you were talking about silver fillings. Do people come in to get those ones taken out now and have white ones put in?
Yeah, we have people that approach us that way, and we talk about the benefits of silver fillings, and we talk about the benefits of the white fillings, so that they can know what to do really.
I had heard, and maybe you can tell me because it's just a rumor, that the silver fillings actually had mercury in them and possibly not good for you.
Well, that's true. I mean, historically, the content of mercury is about 50%. When it fuses and becomes a metal, as it does when it gets hard, the leaching out of mercury happens very, very slowly. So over 20, 25 years, it might lose half of the mercury, but you've probably eaten more mercury in your canned tuna than you have in your silver fillings.
I was just going to have lunch too, but I might reconsider. So cosmetic dentistry, it's pretty important if you want to have that fancy smile, and you can tell people more about it if they come in.
Absolutely. Make sure that it always has a good foundational basis. Don't do it just for looks, because you'll put good money after bad if that's what you do.
Dr. Crapo, thank you very much.
Great.